This is part 2 of a video about upper cervical instability. It's about a sweet woman that loses her ability to speak when she moves her head down, back, tilts from side to side, or juts her jaw forward. All right, so I've got phone calls into people in the field. Oh, well, I've got one of the other things that I noticed. You know what? Let's show this to you. So here you can see the atlas, the space between the atlas and the occiput. You can see basically they meet up kind of nicely. Here you are in a neutral position, no symptoms. You can talk, you can think, nothing crazy is happening. So, and here's the, just with you jutting the jaw forward, and you're triggered. And it's going to take you several minutes to recover from this triggering. And here we go. So I thought it odd that all of a sudden you're going into extension. So you can see that joint surface of the occiput. So your head goes into extension just with you jutting your jaw forward. So the head is as heavy as a bowling ball. So any movements, you already know that you can't move in hardly any position other than neutral without the wheels coming off. So this ligament, if it was attached, reattached, and or the ligaments around here really strengthened, obviously we're going to find anybody in the country that we can find to help us and get opinions. The Prolo guys, they're gonna have to look at this and see what they have to say, as well as other doctors. But we need to keep your head from rocking back. Now, what happens when your head rocks back like that? Well, depends who you talk to. You talk to a guy that looks at the veins, they're going to say, oh, look, your veins get entrapped. You talk to a guy that looks at the vertebral arteries, you're going to say your vertebral arteries get entrapped. And neither one of us are wrong. But what also happens is that the cerebral spinal fluid that goes through there is turbulent. It becomes real turbulent. I'll bet you your spinal cord shakes back and forth like a water going through a turbulent pipe. I've seen that before too. So we expect something like that, or just now the MRI said that there's normal signal going through your cord here. So somehow you recover, or probably because you're scared to death to move your head, so you just keep it in a straight position.
But usually those are supine. You're laying just like you would be upright when they see it versus moving the head.
Yeah, you're correct. Okay. So cerebral spinal fluid going through here can be turbulent. You can injure the cord in there. So obviously there are guys that want to fuse this thing, but I'm not recommending fusion. I'm recommending that ligament be reattached, or all these ligaments getting strengthened in here. We need to make it to where you can move your head around without you going into extension and trapping your jugulars and trapping your vertebral arteries. Causing turbulent cerebral spinal fluid, your cord shaking back and forth, and things that we don't even know. Do you have any questions?
So is it blocking any of these veins or arteries when it's jutting forward, or?
Right, well, so we're going to do ultrasound. So what we'll do is we'll do ultrasound and we'll check the flow of the veins, and the vertebral arteries, and when she juts your jaw forward or does extension, actually just even jutting the jaw forward, it closes these. I don't think I'm going to be able to get to those vertebral arteries. It's going to be real hard. I might be able to get check the blood flow going into the right one. The left one's going to be difficult. We'll try. And the truth of the matter is, I'm not comfortable triggering her so badly that it's going to take her, God knows how long it would take her to recover, by putting her in a provocative position long enough for me to get beautiful readings on this. So to answer your question, I think you can't have a ligament snapped off. The anterior longitudinal ligament is to the cervical cranial junction as the ACL is to the knee. Mm-hmm. So.
And same way forward. When you move the head forward, is it the same effect?
So that's the interesting thing. This ligament is so calcified, it looks like a stick in there. So when you bring your head down, if this thing doesn't seat right in that spot, let's just say it just floats around or it jams up in there, it's acting like a joint mouse. So a joint mouse is something we talk about in the knee. Somebody will say, my knee's locked up, it won't straighten. It doesn't hurt, but and what that is well, there's a piece of cartilage or something that broke off, got between the two joint surfaces, and it keeps the knee from moving. We call it a joint mouse. So it would act like a joint mouse where it's a stick that jams right into the skull there, locking you, and then it's going to push you. What's it going to do? Probably push the atlas forward. I guess what's going to give is the atlas is going to give. It's going to push the atlas forward, and again you're rocking. You're stuck into this rocking position, this hyperextension. I mean, let's just. This is really the biggest thing. Look at the difference. Look how all of this approximates just with you jutting your jaw forward. You go into extensions super easy, and you can't walk around life like that. I mean, look how close this is. It looks like your head's like looking at the ceiling. And I mean, what is the height difference between you two?
About a foot.
About a foot, yeah. 6'1", 5'1".
6'1", 5'1"?
Okay, but I rounded.
Right, okay, right. You want, okay, all right. So there's a foot difference between you two. Right, so again, I pretty much already said everything I need to say. Any questions?
The styloid bones and the C1, are they normal length or too long?
Are they normal length?
Or expected length?
Right, okay. Well, we don't like them when they start to calcify and get longer. So they're longer than I'd like them to be, but typically that's what you see when it's trying to stabilize. You have some instability in the upper cervical spine. I have seen them scheduled for surgery to get the styloids removed, and actually what ends up being really, like in your case here, I kind of don't want to speak about it too much, but it looks to me as though it's really not a matter of the styloid and the atlas. It's a matter of the atlas going forward on the jugulars. So I've had them to where they're scheduled to get the styloids removed. I look at them and they look kind of like you look, to where it's really, if you got the styloids removed, it'll give you a little more space, but really the problem is that the atlas is jammed, going too far forward and then trapping. The mechanical action is coming from the atlas moving forward. And what do you think is causing the atlas to move forward? Because this ligament is not there. It's just mechanically, this thing has to be reattached, or it has to be something. I would think this has to either be reattached or removed, and put a fresh new ligament in there, a cadaver ligament. I don't know how they do that, but we got to find out who's the best in the country to do that.
Okay.
And we will.
And
Between all of us here.
can you show me where the carotid arteries are on here in relationship to the jugular?
Yeah. So I'm assuming you're talking about. Okay, we're going to go to the arterial phase to get a beautiful shot of that. We did 4 phases on you.
And can you show it on the right side?
That's okay. We're going to show it to you right now. So, yeah, and that's what happens when you believe me. I look at jugulars all day long, and you kind of get stuck on looking at jugulars. And if all you're looking at is jugulars, you're going to miss. It's easy to miss everything. Oh, and by the way, I got no problem. Well, I shouldn't say it. How do I say it? I understand why the doctors have missed this for 13 years, because there's so much other stuff to look at. Like, look at that carotid putting pressure on the jugular there. That's something to talk about. Look at that.
So that is the right side
That
without
is
the stent.
Right. Without
Okay.
the stent. So the stent is fixing your left side, and apparently doesn't seem to compress. Thank God. So you did fix a problem there.
But the next step he recommended was the same thing on the right side. But if I fixed the bone, would it fix that problem then?
All
for
right.
the ligament?
All right. So clearly you had the Chiari surgery, you had revisions, you've had shunts put in there, and I'm thinking all this is secondary to when you fell, hit your head, popped that thing loose, and now the Chiari happens because you back up the jugulars, you back up, you have turbulent CSF flow, the brain is going to descend, you're going to have a Chiari. I've seen the Chiaris go back up into the head after you take the pressure off the jugulars or you remove the CSF, turbulent CSF. I've been an atlas orthogonist for over 30 years. We adjust this atlas with precision. Precision acts like magic somehow. You get that thing just right, and the arteries open up even a little bit, the veins open up a little bit, this turbulent CSF decreases a little bit, and it's a miracle. Everybody starts crying in the room. So, been doing that a long time. So I obviously I've spent a lot of money to really look at this area, and now I'm finding, well, what about the people that I do what I'm supposed to do and it doesn't fix them? Well, it's because they got a problem here, they got a problem there, they got a problem in the head, and it's just living the life as an atlas orthogonist. You see things a certain way, and now we're looking at all these things and finding other doctors in the country that look at it the way we look at it. I don't even know if I answered your question.
I think what she's asking is, would you recommend that she go through the surgery to do her other side?
Get a stent on the other side?
Yeah, or would it not make much of a difference from what you're
Or-
seeing?
I guess what I'm trying to
Fix
say
the
is,
bone problem first, and that may clear up
right, so what I think,
the problem on the right side.
right, what I think is, it's a different, what I think is that it's all secondary to your head going into hyperextension too easily. It doesn't, that's the problem. You keep that atlas from going into extension with the skull, and I think you're going to solve a multitude of problems. I think your jugulars are no longer going to be entrapped like they are. I think all the musculature in your neck is going to release. And by the way, when a muscle tightens up, it occupies space. So I think all the muscles in your neck are tightening up, pushing things around. Your carotid's being pushed into your jugular. But it's all secondary to this hypermobility there.
And you talked about the vagus nerve. The vagus nerve controls some of the digestive side also.
Yes.
So if I fix the bone, would it fix the vagus nerve
Right,
piece
right.
too?
Right. So the afferent ganglion of the vagus nerve sits in the jugular foramen. It sits right in here. So short answer is yes. You take any pressure off of this vein, let it decrease in volume, decrease in size, and there will be more room for the nerves that run through there. The vagus, the glossopharyngeal, the spinal accessory.
And the
Glossopharyngeal.
That's the speech
Yes.
also.
The recurrent laryngeal nerve comes off the vagus nerve. Yes.
Okay.
And what about the gait? She has trouble depending on how long she's in the bad position.
Right. So I have seen an atlas adjustment fix all these things in the past, and I've seen it not fix these things in the past. Well, so-and-so, you fix so-and-so, how is it not fixing me? Well, because there's other things that we still have to learn about. Right, so I'm expecting whoever fixes the upper cervical spine is going to be your hero. And I obviously want to take measurements of your atlas and check to see if it's rotated and tilted. And if I put that in a perfect alignment, it will make you feel better and you'll be more stable, and God willing, it'll make a big difference. But how well you're going to hold that adjustment, I need this ligament to be, I need help. Yeah. I can make you feel amazing right now, but I need somebody to make it last.
Yeah. Because even just keeping the head upright right now, it seems like I've got improvement, but as soon as I move, I'm in trouble.
Right.
And does that make sense too, that when we're riding in a car and we're going over bumps, that she loses her speed?
Right, the head's as heavy as
it's
a bowling
not
ball.
connected, right?
And, right, the thing's bouncing around.
Yeah,
There's a lot of plumbing that runs through there.
Yeah.
You bless your heart. I promise you, whoever fixes that your life's going to get so much easier. Can you imagine having your head not really attached and just a bobblehead and nobody's finding it? Because
some of us can imagine that. We don't have to imagine it. We live it.
Right.
Sorry.
Okay.
Maybe for you guys,
Right.
imagine it.
Yeah. Any other questions?
I guess going back one more time to the stenting, at this time, don't do it, probably.
I think you had the Chiari, you had all these surgeries. I think everything is secondary to this.
Yep.
So do I think you need a stent? I think once this thing is fixed, you won't need the stent. You'll stop looking.
Cool.
Okay.
You'll be done. I think you'll be done.
And the CSF flow should improve the same way, you said, right? if I heard you right.
Right.
Okay, and, do you have my other list?
I have your encyclopedia here.
Okay, look, a partial truth portrayed as a whole truth is an untruth. I can't say that this is everything that's wrong with you,
Right.
but I can tell you this man, if somebody whoever has this, they're going to confound the doctors. Everybody's going to be frustrated, and you're going to go down a lot. There's going to be a lot of things going on. So fix this, and then whatever's left over, we'll figure that out too.
Are you able to see the veins that would be in the back of the head?
Yeah, they were bulgy. Okay, this is the arterial phase. Yeah, there's your venous phase in the neutral position. Oh, and by the way, I mean, you already have plenty of documentation that says that the jugulars open up an extension, and yet you lose the ability to speak when you go into extension. So
Yeah, I don't think that one was quite right. As far as but Dr. Huey said both I think the extension and the looking down is a problem. But the last CT I had, I think it didn't relate that.
right,
And maybe I didn't
because the
move
collaterals
head
get
far
compromised on
enough.
extension.
Yeah,
Right, your jugular opens up, but your collateral's entrapped. So that's
okay.
all this back in here, and look at that. This is the first thing we showed you. The back of the head has space in here. You jut your jaw forward, let alone move it, your head, and all of a sudden you go straight into extension. There's no space in here. Yes, you're going to have congestion of these veins in here. They're going to bulge up. I think they're always kind of bulgy a little bit, and they just get a little bit worse. You're just crowding. Everything is crowding because you go into extension. You got nothing to keep you from going too far.
Okay.
You got to have something to keep you from going too far.
Now you have the normal picture, and you have her with her jaw forward. Did you do a third?
I did with extension, but it's just more of this.
It's identical.
Same.
kind of,
Well, I mean-
or similar.
Yeah, it's more of that. And
Okay.
believe me, if you knew how many hours it took me to inventory and catalog everything that's going on here, I haven't even really shown you everything. But
And are you able to see any blood clots in the transverse sinus at all? Or that's
okay,
not your expertise?
that's not my expertise.
Okay.
I don't think it's fair to have one radiologist look at this stuff and him be responsible for
Okay.
everything. Nobody can hold it all in their head.
Okay,
Yeah,
that's fine.
I have no idea. A radiologist would be able to tell you.
Okay, perfect.
I'm just an atlas orthogonist.
Anything else on this picture that caught your eye as far as like her shunt system? I know you're not a shunt guy, I get it, but do you see anything unusual at all?
That's above my pay grade.
Got it, okay.
And are you able to see the medulla?
Yeah, I mean, actually, no.
What?
I'm sorry. No, this is not an MRI.
Okay.
I saw it on your MRIs.
But you wouldn't be able to see any compression on that side, or based on what you're seeing, would it compress that
Right.
too in any way?
Right. So we would have to do an MRI with you an extension, or do an MRI with your jaw jutting forward. I mean, what would be the worst? I mean, to really quantify and qualify everything that happens with range of motion, we would have to do MRI, special slices, and all those ranges of motion if you really wanted to get. But
Okay.
every time you move your head out of neutral, you're injuring yourself.
Yeah.
We got to make it to where, let's make it to where you don't injure yourself when you move your head all around.
Yeah,
Instead, I mean, let's
that would be awesome.
just do that, and then fix whatever else is left over.
And did you say you have seen situations where that ligament is gone or disconnected on other people that you've looked at? Or is she kind of the first one, and now you can go back and maybe look at other patients?
I guess if I'm honest, I'm going to say, when you came in, I learned so much from this. I learned a lot from this case. Now I have to go back and look at everybody that I've ever seen before and see who I missed. Anybody who lost their speech that came to me, I have to go back and look at this.
Ooh, you caused a lot of work.
And it's okay.
Yeah, but maybe I helped others.
I know you did.
Yeah.
That would be an awesome feeling to have gone through this, to at least made somebody else's life much better than
Yeah.
what I've gone through.
Yeah. Yeah, once you
Okay.
see this, you can't unsee this.
Now the hard part is
And it's easy to
finding-
miss it too.
Finding a surgeon that specializes in this. I mean,
It's open to specializing. I don't think there's a lot of guys making a living off specializing in it, but there's going to be somebody who's willing to do it.
Yeah. Yeah.
Yeah.
Okay. Well, I so much appreciate your help and your time. You can't believe how thankful I am.
You're welcome. Thank you, Jesus, for showing me this. I
Mm-hmm.
mean, we prayed and spent a lot of time on this.
Yeah.
You're welcome.
I've prayed a long, long time.
we both have,
Yeah.
So
13
thank
years
you.
you've been walking around with this.
yeah, at least.
But I've had some improvement based on the surgeries I had gone through. But
It always comes back.
it's worse now than it was when I started the 13 years ago.
Well, there are other ligaments in here that are trying to hold you together. It's not just this one ligament. This is the main anchor. So if I just had you hold your head straight and not move for 6 weeks, the connective tissue in here would kind of try to heal, try to tighten up. Obviously, the Prolo guys would want to stimulate it in a certain way. The PRP guys would want to put PRP in there, depending on who's doing what. You know, we need to make all this heal in front of there, and it would be neat as a mechanic. I would love it for a surgical, for somebody who to put a brand new ligament in there or something. And again, I don't even want to speak about it too much because I don't know all the solutions available to this. But
Show me what a ligament looks like.
all right, we can stop the camera and I'll go on to something else. That concludes this report of findings about this sweet woman that loses her ability to speak when she moves her head in any position. We'll make another video once she's fixed. For more information, you can go to our website, lowardsmedicalgroup.com, or email us, help@lowardsmedicalgroup.com. Have a blessed day.